So for today, we are reporting 234 new cases of COVID-19 in the province, including 4 of which are epidemiologically linked, bringing our total number of people with COVID-19 to 14,109. That includes 4,588 people in the Vancouver Coastal Health Region, 8,036 people in the Fraser Health Region, 256 people in Vancouver Island Health Region, 734 people in the Interior Health Region, and 406 people in the Northern Health Region. In addition, 89 people from outside of Canada. We now have 2,344 active cases, of whom 86 people are in hospital, 24 of whom are in critical care or ICU. Sadly, we have one additional death to report today in the Fraser Health Region. And the tragedy of this death is one that I want to share with you because it is something that reminds us of how important the measures that we need to take right now can be in protecting lives. This is a person in their 80s who attended a small birthday party, and by small, less than 10 people were at this home, and unfortunately somebody unknowingly brought COVID-19. And even though it was a small party in one person's home, the majority of people who were in that home became infected with COVID-19, and this person unfortunately ended up in hospital and dying from it. And I know her family and the care teams and the community mourn her, as we do as well. It reminds us that this virus can't tell the difference, and even a small gathering when this virus is circulating can be dangerous. We now have 5,714 people who are under active public health monitoring and 11,448 people who have recovered from COVID-19. Additionally, we have 4 new healthcare outbreaks to report at the Gateway Assisted Living for Seniors, the Mayfair Terrace Retirement Residence, Lakeview Care Centre, and Louis Braillard Home and Hospital. And in 3 of the 4 cases, it's been a single healthcare worker that was identified early, and I think that is, again, a reflection of the important work that we're doing in public health and here in Fraser Health to make sure that we protect people in these high-risk environments. 1 outbreak, in addition, has been declared over at the Zion Park Manor, leaving us with 25 active outbreaks in healthcare, 24 in long-term care assisted living, and 1 in acute care, affecting over 1,002 people, 567 residents, and 435 staff. We have no new community outbreaks to report today, but a reminder that this virus continues to circulate and that we continue to see cases associated with businesses, with gyms, with other settings across the province. So for many of us, we know that fall is a time when many holidays and celebrations occur. We've had Thanksgiving already, and that tragically has led to an increase in the numbers of cases of COVID-19 that we're seeing. We also know that Halloween is coming this weekend. We have Diwali, we have Remembrance Day, and other celebrations in the coming weeks. It is a time as well of cooler weather and increase in coughs and cold season. As well, more people are spending time indoors, and we face the added challenge of having a pandemic of COVID-19 in our community now. Many of the new cases we have today are directly linked to gatherings in our homes and elsewhere that are now resulting in community transmission of COVID-19 across the province. But this has been particularly the case in the Lower Mainland and the Fraser Health Region. This Halloween weekend, we need to celebrate in new ways. We need to keep our groups small, particularly our own households in our homes, and small if we're going out on the streets. We've talked before that we can celebrate in safe ways with our household and our families. If we are doing trick-or-treating, it needs to be small, and it can be done safely outside with small groups, making sure that we give the others the space to stay safe, and also, importantly, to respect those homes that are choosing not to participate this year. We remind everyone that a province-wide order is now in place, limiting the number of people who can visit in our homes. That means no Halloween parties this weekend. This is because many of the things we do at parties and celebrations, things like talking and hugging and eating and drinking together indoors, are much, much riskier, particularly now. And often they're with people that we care about and people we have not seen in a long time. And it's very challenging for us to resist that need to hold people close. Just as we want to keep our groups to no more than 6 when we go to restaurants, so we need to keep our groups small at home. If you are thinking about seeing people from your Safe 6, make sure it is the same group of 6. And rather than getting together in someone's home, choose to go to a location that has a comprehensive COVID-19 safety plans and precautions in place, and where we have seen people following those safety plans in restaurants and in other settings. We know that it works. It does prevent transmission of this virus. There are some very clear reasons for this. First, for most of us, our homes do not have the space for everybody to keep that safe distance that we need right now. Second, our homes don't have those layers of protection that we have built in to other places to slow the spread of COVID-19. We don't use such things as plexiglass barriers and one-way pathways in our homes, which naturally means that we will be closer to each other. And often in our homes, we are more familiar in our familiar settings. We may follow all of the precautions when we go out to a grocery store or when we're at school, but because we're at home, our awareness of following precautions is lower. And finally, while we may have the best of intentions to maintain our distance and use those layers of protection to support those around us, when we get together, especially if we have been separated, as many of us have for a while, it can be very hard to stay apart. And I know that as well as everybody. You know, seeing some of my colleagues here today, it's very tempting for us to want to get close, to want to hug each other or at least shake hands. And we can't do that right now. We have to stay apart and show we care. Even though we may think we are okay and that we have no symptoms at all, we know this virus can be transmitted. And it's those indoor settings when we're close, when we're talking to somebody, when we're sharing food, when we're in an environment where we let our guard down, that it can be transmitted. And it is transmitted to those who we are closest to. When this happens, it can have a very large ripple effect. And we're seeing that with the thousands of people now who are in isolation, and particularly here in the Lower Mainland. So we're not just asking 1 or 2 people to self-isolate, we're asking thousands now, over 5,000 people. And that means they're not going to work, they're not going to school, they're not going to daycare, and unable to care for elders and others who need that support. This is what we have to do now. These are the choices that we need to make today. We need to keep our groups small, and I know that goes against many of our cultural norms. And it's not how we would normally spend some of these important celebrations together. But it is how we need to socialize now, at home and elsewhere. We need to do our part, and particularly this next few weeks, so that we can bend that curve back down across this province. We have seen the impact that has happened inadvertently when people have come together, and we now need to do our part to make sure that we are socializing with our immediate household only, and that we are in a household where there's multi-generational and large numbers of people. We should not be going out and doing some of those activities that are riskier, whether that's going to the gym, going to things like a spin class, or other situations where we might bring this home to our family. I also want to say that I know that most people in this province are doing the right thing. And we see that. We see that in the way that we're able to control this virus. And I want to thank people for doing that and encourage you. We need to do this together. And now is a critical time for us to pay attention again to how important it is to stand together by staying apart and to connect with each other in ways that are safe. And right now, We need to do that. We need to also be aware that when we're out in the environment, that there is still this virus in our communities, and we need to use all of our layers of protection, and that means wearing masks when we're in indoor public spaces for the coming future. I also want to thank people for continuing to do it the way we have in British Columbia, for continuing to be kind to each other, to remain calm in the face of this storm, and to be safe.